Rahim. Assalamu alaikum. I'm Dr. Shiba Akram. I'm a gynecologist. Most of my patients ask me that when they should get the ultrasound scan during pregnancy and why it's important. So I decided to discuss this. Uh, Mainly, the first scan that we do is done in the 6 and 8 week of gestation. And the basic reason for doing that scan is to first of all confirm the pregnancy, and we also want to confirm the duration of pregnancy. We want to see the fetal cardiac activity, and besides, we also see whether it's a single pregnancy, are there twins, are there are multiple pregnancy. And besides this, it's also important to see that this pregnancy is inside the uterus or it's outside the uterus, because if the pregnancy is not inside the uterus, it's basically an abnormal pregnancy, which we call as ectopic pregnancy. So it's very important to look for it as well. So the first scan is really important. Now for the second ultrasound scan is done mainly in the 12 weeks of pregnancy, because this is a very crucial time for the fetus. In this scan, mostly we see the knuckle translucency. If the knuckle translucency is not normal, there could be some I mean, defects of the nervous system, like there could be some Down syndrome, and it's very important to rule the Down syndrome at this stage. We also look that the nasal bone is formed or not, and we also look for the premaxillary triangle. And at this stage, it's also important to know the length of the cervix in case of the female, because if the length of the cervix is taken up, a normal length is 2.5 to 3 centimeter, but if it is taken up, then there is a threat that this cervix will open up prematurely, and that can lead to abortion, and we have to prevent this abortion by applying the Schrodker stitch, so that the cervix doesn't prematurely opens and the baby doesn't get aborted. So this is also very important time. And the third ultrasound scan is mainly done during 18 to 20 weeks of gestational age. And mainly this scan is done to rule out any congenital anomaly. That's why it's called anomaly scan, because by the time of 20 weeks, most of the fetal organs has already been formed, and we have to look whether they are normally formed. We look for the we look for the number of fingers, limbs, fetal organs, its head and everything. And that's a very important thing to do. Uh, these are the basic reason to do this scan. But alongside this thing, we also look for everything, including the fetal cardiac activity, fetal movement, placental location, amount of liquor, position of the baby. We look everything. But the certain periods of gestational age are specific for certain things as well, which I'm telling you. As I told, 12 weeks is important for nickel translucency, so that's why it's called anti-scan, and the 20-week scan is important as for anomaly scan. And then the scan is done between 28 to 30 weeks. That scan is mainly done to see the growth of the fetus. We want to know the baby is growing quite normally, and there should not be any growth retardation. And we also look for the position of the baby and the cardiac activity, movement, like position, everything. Next scan that we plan is in the 9 month. That is, it's sometimes it's done at 34 weeks, and we also plan the Dopplers. And lastly, we do the scan at 37 weeks. 37 weeks is very important as far as the position of the fetus is concerned, and Doppler study is a must at this stage, because we want to know the flow of blood in the baby's heart, in the baby's brain, in the umbilical cord. We want to know the amount of blood that is flowing over there. and that is responsible for the growth of the fetus as well. And we also look for the placental localization. If the placenta is not covering the os and the position of the baby is normal and everything is normal, then we plan a normal vaginal delivery. But if the position of the baby is not normal, it's not a normal cephalic position, it's breech or it's transverse or it's oblique or something like that, and the placenta is not giving way and it's located just across the os, then we cannot go for a normal vaginal delivery and we have to plan a lower segment C-section. So that's why we do these scans. So this much number of scans, it's mainly 4 to 5 scan maximum, and the reasons why we do it, I told you about. So this much is about it. Thank you.